slide. No, everybody should have heard that. So here are the fine folks that you will be hearing from today. We will introduce ourselves as we speak, but as you can see here, we have wonderful people from housing, from the funding government community, from regional government, from nonprofits, and this is really representative of the partnerships that made this work happen. So the next slide. We are going to try a poll. So that's us. We'd love to know a little bit more about who's in the room today. So I'm going to attempt to start a poll. And if you could just let us know who you are. And I think we'll be able to all see the results here. So if you could just mark who you're with, knowing that we probably didn't capture every category. Yeah, and it's looking already like we have a pretty good spread, and again, representative of all the different kind of constituents that are involved in this work. Lots of folks from government agencies and CBOs, and plenty of folks from public transit and mobility as well. So thank you, everyone, 90% of people participating here. So I'm going to end this poll, but I think you can all see who's in the room today as we have this conversation. Okay, so with that, I think we are going to get started, and I'm going to hand it over to John.
Hi, I'm John Massetti, an air pollution specialist at the California Air Resources Board, or CARB, tasked as the CARB liaison for this project. Since 2014, CARB's Clean Mobility Options, or CMO program, has funded clean and shared transportation services like EV car share, bike share, transit subsidies, and EV shuttles to tackle both reducing vehicle pollution and increasing transportation equity among disadvantaged communities. This program is largely funded by California Climate Investments, a statewide initiative that puts billions of cap and invest, formerly known as cap and trade, dollars to work reducing greenhouse gas emissions, strengthening the economy, improving public health and the environment. In April 2017, CARB's competitive solicitation for Carsharing and Mobility Options pilot projects closed. And this project, the Carsharing and Mobility Hubs in Affordable Housing Sites pilot project, was awarded $3,015,000 to the Metropolitan Transportation Commission, or MTC, and their team of Transform and other community partners to design and implement 3 mobility hubs at affordable housing communities in Richmond, Oakland, and San Jose. This project scope differed from previous mobility projects by first conducting a Community Transportation Needs Assessment, or CTNA. This CTNA included surveys, focus groups, and interviews with community residents to tailor the mobility hubs to their needs. Conducting the CTNA itself was challenging during COVID-19, but the project partners persevered. This particular project has informed CARB about subsequent mobility projects. CARB now offers separate community planning grants to get projects off the ground, and new CMO projects require such a community plan before implementation. Also, CARB's newer mobility projects offer more technical assistance and have longer project terms to help overcome unforeseen project delays. Thank you, and I'd like to hand things off to Krute Signet.
Great, thanks, John. Hi, I'm Krute. I'm from the Metropolitan Transportation Commission, or MTC, and we're the planning, financing, and coordinating agency for the San Francisco Bay Area. So I'm going to provide an overview of the pilot project, kind of starting with how we defined a community-centered mobility hub. So for this pilot, we defined it as a strategically located site and set of services within a community that provides access to options like electric vehicle car sharing, transit passes, bike storage, ride credits, and educational resources, all kind of working together to make sustainable, affordable mobility options more accessible to users. As John mentioned, the pilot was implemented at 3 affordable housing communities throughout the Bay Area, as shown on the map. And I'll provide more information on these sites in a second, but I first want to highlight the goals of the project, with the main one being to expand affordable transportation access to jobs, schools, medical facilities, grocery stores, and other essential destinations for low-income residents. The other goals were to deliver clean mobility solutions informed by resident needs, reduce greenhouse gas emissions, reduce transportation costs for residents, and lastly, to create a replicable model for integrating mobility hubs into affordable housing. Next slide, please. So I believe through this project, we demonstrated that community-centered mobility hubs can be successful when designed with and for the people they serve. And we were able to have the success through the partnerships that existed or were cultivated through the pilot, kind of as you saw on the earlier slide. So as John mentioned, the California Air Resources Board funded the pilot and helped us iterate on project design. We at MTC were the administrator of the funds and partnered with Transform and the Shared Use Mobility Center to create the project team. And as a project team, we created strong partnerships at each of the project sites that were selected based on California disadvantaged community designations, and had affordable housing operators that both had a presence in these communities and also demonstrated interest in providing clean mobility options. So we ended up partnering with First Community Housing in San Jose, the East Bay Asian Local Development Corporation in Oakland, and the Richmond Community Foundation and the City of Richmond in Richmond. Next slide, please. So now to kind of get into each of the sites. In San Jose, we partnered with Betty Ann Gardens, which is a family-oriented affordable housing development. In Oakland, we worked with Lions Creek Crossings, which is an affordable housing development with a large senior population. And in Richmond, we worked in the Nystrom neighborhood. So the residents at each of the communities are mainly people of color, with over 75% living below the federal poverty line. The sites reflect a range of urban and suburban environments, and they each have kind of varying levels of existing transportation infrastructure, which led to each one having distinct travel needs. But actually, this diversity allowed us to test and refine the different approaches, and also respond to different challenges. So I'm going to turn it over to Jennifer to talk more about how we tailored services for each of the communities.
Hi, everyone. My name is Jennifer Leday, and I'm a program director at Transform. Thanks, Kruti, for kind of giving the overall program structure and giving us a little glimpse into each of the sites. Now I'm going to kind of walk you all through the overall flow of the project and let you better understand how we did this work. And then I'll go into more details about each of the different elements. We'll all talk about the elements and also really focus on the lessons learned. So first, we established site-level teams of residents representing each of the different communities. Then we conducted a community-led transportation needs assessment. Next, we established different mobility options that would be promoted at each of the sites based on that needs assessment. Then we did outreach and educational events while signing up residents for the mobility services. And finally, we gathered data throughout the process through multiple surveys. All right, so this program was really groundbreaking because we were able to bridge the gap between lots of different partners in the project, right? So there were project administrators, nonprofit staff, the staff that were on site in each of the communities, and then the community members themselves. And so we did that through the establishment of the site level teams. And the site level teams were paid resident leaders who both helped design and implement the program. The site level team at each site was unique. It was based on that particular population. So in San Jose, There were mobility interns who you'll hear a little bit more about later. And in East Oakland, there were residents, some of which that were there the entire 6 years of the project. So, as trusted community members, the site level team members were really the ambassadors of the Mobility Hubs program. We really were able to leverage them as early adopters and best able to get other residents on board when we were introducing new mobility options. We saw this throughout the project, but one quick example is just with the launch of the Lyft Essential Rides program that provided free Lyft credits to families every month. And residents were really cautious at first, not sure how it would work. There was technology involved, but by having the site level team members try it out first, they were really able to be those ambassadors and help communicate with others and troubleshoot issues that came up along the way and then connect with us when they needed support. So one of our primary roles at Transform was helping facilitate the ongoing meetings with the site level team members. And throughout that process, we learned the importance of meeting residents' needs, providing services like childcare or activities for kids if they were attending the meetings, live interpretation during the site level team meetings. And one thing that always came up was really the importance of having food. Not just having food to keep people engaged, but also meeting times were often in the evenings, after work, after school hours. So wanting to be able to like respect people's time and provide them with something during those hours. So that's a bit of background on the site level teams. And now I'm going to pass it off to Edith and David, the site leads in San Jose and Oakland, who were really the ones who helped guide this process. And they can tell you a little bit more about their personal experience. Edith.
Hello, everyone. My name is Edith Figueroa, and I was the program manager for First Community Housing during this project and the site lead for the Mobility Hub at Betty Ann Gardens in San Jose. My role consisted of executing all the amazing hard work that was being done behind the scenes. Some days that consisted of working with vendors directly for installations, keeping ownership and on-site property management aware of where we were in the process, as well as connecting with the funders and project partners for guidance and support. We did have big decisions to make when it came time to do outreach and promoting everything that the Mobility Hub had to offer. We wanted to really think outside of the box. And with so many college youth that had grown up at the property, we decided to create a paid internship that college enrolled residents 18 and over could apply for. We had them turn in resumes and even went through the interview process. Our goal was to give them a full internship experience from start to finish. The end result was 2 part-time mobility interns that both lived on site and were enrolled in college courses. Mobility interns got to experience being in professional internal meetings and in a professional office setting, while simultaneously actively promoting the Mobility Hub to their neighbors through a variety of events. They were part-time, so they did about 18 to 20 hours a week, and we would do weekly check-ins as well as check-ins the day of events to make sure that they had all the supplies that they needed or any questions regarding any of the materials they were promoting. I do think that the dynamics are very important to think about in selecting mobility interns because they were working very, very closely together. It was really rewarding to see these young residents challenge, trying new things, and really learning to solve problems along the way for the first time. The responsibility they carried through this process really gave them a newfound confidence in themselves, and it was really such a big joy to see them grow. Now I'll pass it on to David, who's also another site lead.
Hi, everybody. My name is David Cota. I'm the community organizer for Evolsi. And here in Oakland at Lion Creek Crossings, we did a different approach. We used to form the site level team. I was to recruit residents who live at the property. Like in Richmond, they use interns, student interns for the site level team. we decided to recruit residents who live at the property. We wanted to have residents representing the population who live there. So the SLT represented parents, seniors, Spanish speakers. We have young adults. We have parents with their young adults also being part of this SLT at the beginning of the program in 2019. We have set of parents with their young adults coming to the meetings. We also have, so it was very intergenerational at that time. We also have people in wheelchair also coming at the beginning or at that time. So these were people who lived there for many years, and having those young adults who was very instrumental because they grew up there. They knew all the other young adults. So the feedback that we got from them when they were trying out these new services, it was very instrumental to have that knowledge from the young adults. So having those residents who live there and being available 24/7 was of great advantage. They hear and see anything. They know their neighbors, their experiences, and everything. So that was very instrumental to create that kind of a structure from the same residents. Of course, that as they mentioned, Edith and Jennifer, they were compensated for all the time and the meetings, for outreach, for any other efforts that they did. One of the things that came out is that a lot of the residents who participated as part of the leadership of the site level team is that a lot of them, they became like strong leaders, not only ambassadors of the program, but also like strong leaders in their communities. So, and I'll pass it out back to Jennifer.
Great, thanks. All right, so once the site level teams were established, one of the key next steps was the transportation needs assessment. And we wanted to make sure that we were grounding decisions and program offerings in community needs, not just coming in and saying, this is our plan, this is what we should do, but really doing a comprehensive needs assessment to understand what are the existing transportation options, what are the barriers that people have to using transportation, and really what are their priorities? What do they want to see at each of the sites? So again, a one-size-fits-all approach does not work. Everything was unique at each site, and we really wanted to treat each site uniquely based on their needs. So the needs assessment itself was a survey that was administered by the site level team members to other members of their community. There were some, sensitive demographic information that we asked for in those assessments. So again, it was really important to have the site level team members be the ones interacting with other people that they already knew, their neighbors, and asking that sensitive information when we might not have had an easy time getting the same responses. So again, the site level team was key in actually the implementation of the needs assessment. The process was really shaped by community voices, and the findings were important to guide the project approach. But the needs assessment process itself, like John mentioned earlier, really set a precedence for equitable mobility investments, with CARB adopting it as a model for similar projects, so future projects, including a transportation needs assessment. So one example of why the needs assessment was so critical was that initially with this project, there was a goal of having 8 EVs, electric vehicles, at each site. And throughout the assessment, we discovered that the substantial portion of residents at each of the sites, 16 and older, didn't have driver's licenses. So if you're looking at the chart here, you can see the light blue section at the top for each of the sites. And in Oakland, we actually saw that half of residents 16 and older didn't have driver's licenses. So EV car sharing really wouldn't be the most practical or effective offering at that site. And CARB was really able to be responsive to the needs assessment results and shift the program to truly fit the community members' needs. Next slide, please. So, taking the needs assessment information about driver's licenses into account, the fact that the majority of residents regularly used public transit in Oakland, and the focus shifted at Lion Creek crossings. So we wanted to provide residents with AC Transit Easy Passes or just free bus trips. As you can see in the graphic here, the overwhelming majority of residents at each of the different sites were really interested in access to transit systems as they reported regularly using public transportation. And this finding really helps reinforce the need for access to transit for low-income populations beyond just this individual project, but really this is a reflection of the different populations in the Bay Area and a good reminder of where we can invest time and energy and resources. So now I'm going to pass it off to Colin to talk a little bit more about the process of actually getting those different mobility options to residents after we identified the priorities in the needs assessment.
Thank you, Jennifer. Hey, everybody, I'm Colin Murphy. I'm Director of Research and Consulting at the Shared Use Mobility Center in Chicago. And I've been part of this project almost since the beginning, not quite since day one, but quite a bit along the way. And so I'll be talking here about the procurement and ongoing maintenance of the different mobility service offerings at the different sites. So first, there was electric vehicle charging and car share. The project installed EV chargers in San Jose and in Richmond, and it placed car share vehicles in San Jose. And each of the sites and services had different providers in terms of the charging providers, in terms of the car share providers that were chosen. And ultimately in San Jose, the car share services were provided by Envoy. Richmond was slated to get car share, and there was a contract in place with a provider, but as you'll hear a little more about later, due to vandalism of the chargers, that we weren't able to kind of work around in the time frame of the project. Ultimately, we did not end up offering car share in Richmond. In Oakland, as Jennifer said, we sort of shifted away from a heavy focus on car sharing. That was sort of supported by some other things that were going on, part of which is that dedicated parking for EVs and to place chargers was not really feasible, and that trying to put those chargers and vehicles in the public right of way would have meant a really long permitting process that we just weren't kind of prepared to go through as part of the project. Next, we have the Lyft Essential Rides. So we knew from the needs assessment that many residents, especially in Oakland, didn't have driver's licenses, and needed other options. But there are still, given the world we live in, still many trips require the use of a car. So we worked with Lyft to provide discounted ride hailing for residents. So this was enrollment was limited to site residents, and then once they were enrolled, they got $40 a month in ride credits for trips that started or ended at the sites. This was built on the back end. For those of you who are interested, this used Lyft's business dashboard to set up a ride pass program at each site. This was offered across all 3 sites, and it looks like it served at least like more than 2,000 rides over the course of the program. And then next would be the public transit services, really centered on the AC Transit Easy Pass. Transform worked with our partners to introduce the AC Transit Easy Pass, which provided each household with unlimited AC Transit, basically bus rides in the East Bay. That had a little more kind of on the administrative side than we originally anticipated. It needed somebody with direct access to the resident records to oversee the registration, track move-ins and move-outs, and make sure people were still qualified, deactivate old passes, issue new ones. They needed a photo. And a lot of this was in the midst of COVID-19, a little bit of a challenge, but it all came through in the end. As of the final report, there was about 80 regular riders, mostly that was all out of the Oakland site, and folks were taking more than 1,500 trips a month, so more than 1 trip per day per user. And then there was also Clipper Start is another program that MTC runs that provides discounted rides for households that are under 200% of the federal poverty level. And that so Transform also connected residents at all the sites for that. And then finally, we should talk about bikes. So expanding bicycle access was a core part of the pilot. And one of the concerns was about theft. And so MTC and First Community Housing worked to install secure bike storage at the San Jose site that stored, at first it was 28 bikes. I think it was later expanded with security cameras, resident-only access with key fobs, and so just a good, safe, secure locking bike room. And then we also conducted bike giveaways at several of the sites. Next slide, please. So just thinking about some of the lessons that we learned out of those processes, we found that you need a really solid RFP, request for proposals process, for identifying vendors that are not only technically capable, but prepared to really collaborate on an equity-focused project, especially with kind of the reimbursement process and delays and longer timelines that might be involved in a publicly funded project like this. That posed some challenges with some of our vendors. And for smaller firms in particular, they may struggle with those kind of delays and having to float money for a project like this. So setting clear expectations up front is very important. We were, in terms of infrastructure and site readiness, we were working in historically underserved communities. And so in addition to the kind of visible disinvestment that can mean, there's a lot that's we found there's a lot that's hidden, and just basic electric infrastructure was inadequate in several sites. So a lot of the kind of disinvestment that we see visibly is also there in the grids. And so you need to be prepared to invest in the grid, in grid upgrades. We had supportive city partners, but permitting processes around EV installation can still be pretty long, pretty unclear, and slow moving. And so doing what you can to streamline permit approvals should be a priority. Related to that, we found that it was a lot easier to do things on private land. So working with First Community Housing made things easier because they controlled their own site. We didn't have to go through public processes and get official resolutions at multiple steps along the way. So that allowed us to move things more quickly. And then finally, security, sustainability, vandalism. Vandalism was a big issue, especially in Richmond. Basically, metal scavengers have figured out that charging cords have a lot of copper in them. They've become a target, and we're seeing this across the industry, and we're hearing about it in more and more places, unfortunately. So we wanted to focus on avoiding just adding cameras to places that were over-policed and over-surveilled already. This was sort of a balancing act between physical hardening of the locations and maintaining access for the public. So that's something that folks should think about in kind of designing these for next time. And I will hand this back to Jennifer.
Thanks. Okay, so after conducting the needs assessment and then beginning to establish those partnerships and the different systems for the program implementation, then we started working on outreach events and integrating education efforts. So keeping with our commitment to inclusive community-led planning, the site level team and the site coordinators really played a central role in shaping the outreach efforts and gave us a lot of input to help ensure that outreach strategies were relevant, engaging, and accessible to residents in each community. So the site level team members let us know which type of engagement activities they would like to see. So there were large mobility fairs in Oakland to community-centered events like a bike ride series in Richmond. And they also let us know how to best reach their neighbors and what worked best. So what worked for the senior building in Oakland didn't necessarily work best for a large neighborhood in Richmond versus families in San Jose. So again, the one size doesn't fit all approach. The site level team also really helped refine our branding and our messaging and informed us on the type of language to use and designs that would be most engaging. So, for example, when we were designing a flyer for Line Creek Crossings in Oakland, um, we had just listed a name of a park where an event would take place based on Google Maps. And the site level team let us know, what park is that? We've never heard of that before. And they're like, that's not what we call it. So this is what you should put on the flyer. So just getting that sort of input on our outreach was really helpful from the site level team. Another part of outreach in helping people actually sign up for the different mobility services were incentives. So incentives were key to get people engaged, but also to recognize people's time and effort in filling out surveys. So the community members, the state level team also gave input on the different types of incentives that we provided, and residents let us know that they were much more interested in having gift cards to grocery stores like Safeway or Costco versus a Starbucks gift card. And finally, in our ongoing meetings, after an event, we would get feedback and take notes on like what we wanted to shift in the future. And through that process, we got really good feedback about having more live interpreters at events. So that was something that we learned about our outreach. We had already planned for interpretation, but really recognizing what the need was. An example of this is that one thing we discovered were that residents who spoke a certain language were not necessarily fully literate in that language. So even though we had printed surveys in lots of different languages, they wouldn't necessarily be able to read or complete those surveys, and so they needed extra support. So really having that live interpretation was key. And that was something that we were able to adjust and make sure that we had enough interpreters based on each site and what their needs would be. And so that really just helped ensure that language would not be a barrier to participation. All right, now I'm going to go back to Edith and David to let you know a little bit more about what outreach looked like at each of their sites and share a little bit more about their experiences. So back to Edith.
So all events at Betty Ann Gardens were led by the mobility interns. Every month, they would publish and flyer a calendar of events. All events were family friendly, and they always had an info table where people can come and learn more about how to sign up for Lyft credits, how to sign up to use the electric car share program, and also how to use the bike room. Some of the events ranged from movie nights, outdoor canvas painting, baking nights, electric car share car tours, how to use an e-bike info sessions, and even family-style potluck nights. Since our mobility interns know their neighbors well, they quickly decided to establish all events in the evening since Betty Ann Gardens is a family property. Every resident that signed up for the Mobility Hub service was automatically entered into a raffle. The raffle was held at the end of the month, and they had a chance to win an electric bike. There were several electric bikes that were raffled. In addition to that, everyone that signed up for a Mobility Hub service was incentivized and received a gift card. Mobility interns managed and tracked gift cards going out, as well as making sure residents showed proof of signing up for any and all services. Overall, the mobility interns maintained a very, very busy internship. I will pass it on to David.
Hi, so here in Oakland, so we conducted a couple of mobility fairs, and we used those as a way to outreach residents and let them know about the programs and different services that we were bringing to the community, so they can and see what was available to them. And other times we use those mobility fairs and other events so they can try these services, and also to enroll them to programs like the AC Transit Easy Pass program, and also for the bikeaways. We gave over 30 bicycles away in one of those mobility fairs. We also have we organize sign-up events. There were some populations that we need to have like specific sign-up events due to language. Like for instance, we have at the senior housing a large Chinese population, so we need to have a sign-up event just in Chinese so we can sign up people there. So yeah, so we had those type of sign-up events as well. And also we participated in other community events that were happening there, like National Night Out and back to school events and things like that. And I'll pass it back to Jenny first.
Oh, I think this is me. Yeah, thank you, David and Edith. I'm going to talk really briefly about the community surveys and findings. We're running a little long on our talking here, so I'm going to go through it as quickly as possible and refer you to the printed report or the downloadable report that has all this in a lot of detail. So we were trying to have multiple touch points with participants and residents throughout the pilot, from program design, understanding travel behaviors, measuring the impacts of the program, refining our outreach strategies. Partly this was due to requirements from CARB, but really we just wanted to understand how perception and usage were evolving over the course of the project. And you know, letting us adjust the pilot as we went. So we did a number of different surveys. First, as Jennifer has spoken about, we did the needs assessment in 2019. We did a survey in 2021 on how people were adjusting their transportation needs and patterns in response to COVID. And then that mainly helped us adjust how we were doing outreach and as the pandemic was really impacting people. We did onboarding surveys as people signed up for the different services, as well as a midpoint survey after 3 or more months of usage. And then finally, at the end of last year, we did the final survey where we were trying to figure out what the ongoing, what had happened over the course of the project, and then how to prioritize our future work. And then we also did focus groups alongside the needs assessment and the final surveys. And I'm going to not really talk about findings too much. Again, please read the report, and we can go to the next slide. Just in terms of some of the lessons we learned about administering the surveys, we found that especially on the needs assessment and then in an ongoing way, we really relied on the community trust that we had built up through the site level teams and through working with residents and having kind of trusted voices asking people to fill things out rather than you know, somebody coming in who they've never seen before. Related to this was making sure that we had time and resources for translation. That was something that we really built into the process. We had surveys and focus groups among the languages that we did things in were Spanish, Simplified Chinese, Arabic, Farsi, Tagalog, and Vietnamese at different points along the way. So just if you're designing something, if you're designing a project like this, definitely budget for this, budget for the staff time around coordinating this stuff, and also for interpretation in live settings. The formats and outreach are important. You've got to meet people where they are. That meant paper, iPads, like bringing devices, or you know, having ways for people to fill them out on their own. Different folks are comfortable with different things, and so just make sure there's a range of options for getting that input. And then finally, respecting residents' time and input, and that means first, just at the most basic level, providing incentives for people to fill these things out, and avoiding survey fatigue. So we touched folks a lot of times. We tried to avoid kind of making that something that would create fatigue for them in filling these out. So making sure that we're preventing overlapping requests for input. And then I think the flip side of that is making sure that people can see how the input that they're giving actually is reflected in changes to the program, and letting people know about that. So I will now throw it back to Carrie with another, again, go check out the report itself. It's got all this in much more detail.
Thanks, Colin. Yeah. So this is our last slide, and then we're going to get to Q&A. please do check out the report. There's 70+ pages of detailed lessons learned on each portion that we've spoken about today. But I want to wrap up the presentation by talking about some themes that emerge again and again that are sort of overall lessons learned for this project. The first is thinking about providing the right support at the right time. So we have funders, government agencies, project leads. We all needed to provide technical assistance and seek technical assistance at critical times, from moments where we were designing infrastructure to launching CarShare to thinking about those apps and the language needs behind those apps. So think ahead about what technical assistance you might need and start to line that up. Similarly, in terms of support, think about streamlined administration between the mobility service providers and the site partners. Affordable housing owners and property managers oftentimes don't have a lot of experience with mobility services. And so all of that transportation management takes work. The approvals, the payment systems, they take learning, they take negotiation, they take contracting, and we really aim to support our site leads in moving through that in a streamlined way. The next is, you've heard it throughout, realistic and flexible timelines. The longer, more flexible timelines allow for the due diligence, which is inevitably going to happen. It also allows for being responsive to partner and community needs that you might not anticipate and accommodating the unexpected. The next thing is collaborating and planning ahead on implementation hurdles. So things that were already mentioned, like getting permit approvals, using parking spaces for EV chargers, both using the land and also talking with people about using their parking spaces for EV chargers. You can imagine that is going to take a little bit of extra work. Upgrading electrical systems, addressing vandalism, having good working relationships in place and understanding those processes in advance can allow you to be proactive instead of reactive. Next, we can't overstate the value of empowering site partners for success. So I want to again thank Edith and David. I also want to thank the folks from RCF Connects and SparkPoint in Richmond who aren't on the panel today, but did similar work in the Nystrom neighborhood. Really, the site leads and the SLT are the bridge between the residents, the mobility providers, and the project administrators. So we've talked a little bit about compensation and building that into the budget. We recommend allocating at least 35 to 50% of a full-time equivalent compensation for staff who are on the ground doing this work. Build that into your budget. Be sure to clarify roles and responsibilities up front. Is the project lead going to do this? Is the site lead going to do this? Is the site lead, do they have what they need in order to do it? Also, we've spoken a bit about bridging the accessibility gap. One of the things that we didn't talk about here so much is banking and payment requirements to ensure equitable access. A lot of our residents were unbanked and didn't have credit cards, and yet the apps like Lyft require credit cards to even just sign up. There are some options to get around that, but definitely thinking in advance about that and working with your mobility service providers. The next is language accessibility. We spoke a lot about that, so I'm going to move on from that. And then the next thing is digital literacy and senior accessibility. Many of our senior residents were uncomfortable or hadn't done a lot of navigating of smartphone apps. So really thinking through how to plan for in-person services, sort of tutorials, working with their mobility service providers to provide step-by-step instructions, ideally in multiple languages. So you can really have equitable usage of these services. And then finally, embracing the unexpected. So our pilot happened during a period of unprecedented global and social change with the COVID-19 pandemic, and simultaneously there were nationwide protests in 2020 following the murder of George Floyd that really profoundly impacted the communities that we served. And so these experiences reinforced the importance of that community-centered flexibility. A truly equity-focused project is listening to residents and adapts to these changing realities and shifts priorities when necessary. So if you have to push pause on the work because the residents are dealing with other things, building in that flexible timeline and making a commitment to being adaptable is what's necessary. So with that, we are going to move to Q&A. I see some questions in the Q&A. Thanks for folks who put in their questions already. It seems like some of them have been answered. Great. Let's see. There were also some folks who had questions in the registration. There was a question about offering wayfinding classes. Jennifer, do you want to speak to that?
Sure. I think it depends on, what the exact interpretation is of like what are we looking for as far as wayfinding classes. But just an example of one of the things that we did at Lion Creek Crossings with the AC Transit Easy Pass was we worked with AC Transit to really help people understand how they can best use their pass. So they developed maps that had, the property itself, and then all of the bus routes that were nearby, and then different points of interest, places that people might be interested in going, need to go, like grocery stores or doctor's offices, but also then other places that might be interested for them to go on the weekend, for example. So that was one way in which we kind of helped people understand then how they could use their pass and being able to get around.
Thanks. Anybody else want to jump in on that? Okay. There's another question here about how the hubs were branded. And I love that question. So one thing we didn't touch on here, but it is explained a little bit in the report, is we worked with a wonderful consultant, Emergent Labs, Brittany Brown, here in the Bay Area. And we did a whole process around communications, for, sort of external communications about this project. Where I believe we actually talked with residents again to say like, hey, how would you talk about a mobility hub in a way that made sense to you? And then we had a specific pilot website, the Mobility Hubs pilot website, that was resident facing, that really simply broke down each of the mobility offerings. That's also where you could sign up for the services. And it was also where we did some of our surveying. So working again with community to talk, to think about how to talk about this in ways that are relevant to the community, and bringing in communications consultants to help you. And then we had a series of branded materials, like I think you saw one of our flyers in Spanish on one of the earlier slides. That was all actually part of the project that was funded. There was another question in the registration about the future funding for the project. And I wonder if John and Kruti have anything to say about that. I can also jump in as well.
John, maybe you can answer the question. I'll just start with saying that this was a pilot project, and then with the lessons learned on how to kind of keep it going, we were lucky to have CARB extend the contracts and the payment to the contracts, especially for car sharing at Betty Ann Gardens after the project period ended. So some pieces of the project are still going on. But John, would you like to talk about the Clean Mobility Options Program and funding through that?
Yeah, right now we have the clean mobility. This project, like this, it kind of transitioned or evolved into the statewide Clean Mobility Options Program. And that particular program, like I mentioned earlier, had planning grants, and it had rounds of mobility project funding. And that particular project as a whole, I believe, has like 35 planning grants, and I want to say probably about another 35 mobility projects throughout the state. And those particular projects received some seed funding, and then as the projects went along, and we were able to add a little bit more funding to extend project lifetime, because again, there were delays and such for implementing those projects. And that particular program it's been completely funded, and it will not be getting any more funding, but CAR would like to have another solicitation out one day when there is funding available. There is no funding available for a new mobility program this fiscal year. But when future funding becomes available, we would like to have like a CMO version 2 or something like that, and it would include probably more technical assistance and other lessons learned from that newer big version of that project, and then it would come along into another version of that project that could happen next fiscal year or the fiscal year after that. I'm not sure, but it depends on when funding is available.
Thanks, John. And I think I'll add, it's true that projects like this, they have their period of funding, and then we want to continue to have the services available. And so I think it's something to continue having the conversation around. We were talking before the webinar started that one way for that to continue is actually to go from moving mobility hubs as a pilot into something that we are used to seeing in our communities. And that happens by getting it into local and regional transportation plans. The work that we did here, we truly believe it's scalable. You can learn from our experiences. And when we started this project, when we submitted the application in 2017, 18, mobility hubs were a new concept. And now, we are seeing them proliferate throughout the country in a variety of ways. And so I think part of how we get them funded is by building them into all of the infrastructure planning that we're doing around transportation, just as you would roads and bike lanes and all the other important parts of how we get around and public transit. So I think with that, we're going to wrap up the Q&A because we want to try to respect people's time and wrap up on time. So we really wanted to end this with, as we've said, community voices and some of the folks who are not on this, not in the panelist room with us, but we've mentioned and we're critical to the program's success. So we're going to show a video here that shows some of the mobility interns at Betty Ann Gardens.
My name is Jennifer Delgado. I am a Betty Ann Mobility Intern program that allows Betty Ann residents to take advantage of these discounted transit services. We know that many Betty Ann residents, much like myself and Jocelyn, face many difficulties with transportation, and we hope to ease those problems and help them strive for their goals with these discounted and available services at their hands.
It is interesting to get one of the electric cars for an hour, or to be able to have an alternative to get around, because I walk a lot, and so gas is expensive. So I'm trying to be economical with my resources. So this is interesting to me.
As a single mother and college student, not many know the struggle it is commuting to and from doctor's appointments, college classes, daily errands, and tasks unless you actually live here. These discounted resources are a gift not only for myself, but for my community. I have seen firsthand the doubt in residents' eyes when we explain to them everything is available to them here at home through the mobility hub. These available discounted transit services have allowed me to continue to live my life without the added stress of not having reliable transportation. Betty Ann Gardens, the different options for residents are they have discounted transit programs. They also have access to a bike storage room, also done bike giveaways. In addition to that, one thing that just got launched is the EV car share. So they have access to discounted electric vehicle car share. There's also the Lyft Essential Rides program, where residents are able to get $40 a month in Lyft credits to get to where they need to go.
Thanks, Liz, for the video. So just to wrap up, so if you take a look at the folks here and the panelists, and also all of you who so kindly took your time to join us today, we have everyone we need to make this happen. This is the makeup of a pioneering partnership, and it's also the makeup that we need to scale this kind of work across communities, across California, across the country. So please learn from our hard work about how to do this holistically. This is really about more than just delivering transportation options. This is about helping people have better health, education, employment opportunities, and outcomes. This is also, as we hope you saw today, this is about leadership development. This is how we build community. This is how we build resiliency in a time when these very communities are under great threat. So please take this into your community, and we'll go to the next slide and say, if you have questions, if you do this work in your own sector and you want to talk to the folks here today in your sector to learn more about how we did this work, please contact us. Sydney dropped the report into the chat. And I think we also have the video is available on YouTube. So thanks again, everyone, for joining us today. And thank you for going out and doing this work in your communities as well. And thanks for the applause.